everybody, welcome back to the show. It is always a pleasure to see our next guest.
And I always wondered, but I've had that question answered now. Do people always say, hey, Dad, I got this thing on my shoulder.
I just made him look at my sliver.
Dr. Daniel Kalla, ER physician, author, of course, of a great book called Of Flesh and Blood. Hello, how are you, sir?
Great
nice to see you. Do you get that all the time? I mean, when you go to parties, do people ask
just
you?
Here. Fiona's the first one ever. Yeah, no, it comes up a lot.
I can imagine.
He told me I should see somebody about it. I'm like, I am.
Why else do we know you, Dad?
Anyway, slivers aside, we're talking about the new year, and we're going to start off talking about gallbladders.
Yeah.
Why are we talking about gallbladders in January? Is it a special time for them?
It is a special time because so much gallbladder disease is related to high-fat diet, right? And that's what usually precipitates either the forming of gallstones, but also gallbladder attacks. So we tend to, after all the turkey and all the big meals over Christmas, we do see a surge in gallbladder
Okay, here's my stupid question. What is a gallbladder? What does it do? I don't even...
Yeah, it's a little sac that sits right under the liver, and it stores bile, and bile helps you digest your food. But we don't need it. Your liver still produces bile and still secretes it into the intestines without the gallbladder. But it does theoretically help a little bit with digestion. But
so
it's easy to form
kind of an evolutionary leftover?
Yeah,
or just
like
an
the
extra?
appendix, right? Like, no, it actually does something, but you can get by without it.
So
right?
if one has gallbladder problems, is it one of the things people get removed, or is
Absolutely, yeah. You can form these stones in the gallbladder, and a lot of people have stones and never know it, but some people become very symptomatic with these stones. Sometimes it's just an issue of every time they eat a fatty food or diet, it causes the gallbladder to contract around the stone and just causes one of these very painful attacks. It can be more serious, though. The stones can get lodged, can leave the gallbladder, get lodged in the bile duct and block everything up. Ooh. And then it inflames the pancreas, because the pancreas drains into the same
and then you've got
system,
problems.
And then you get
Now, does one pass them like kidney stones or these things that you have to get removed surgically?
Very occasionally. It's very difficult. Yeah, like you say, most kidney stones you pass on your own, but with gallstones, usually you either ignore them or get them removed.
And are the symptoms just sharp pain or?
Yeah, it's usually pain, and it can be in the gallbladder sits in the right upper quadrant of the abdomen.
I was going to ask. I don't even know where my liver is. Yeah. Where is it?
Liver's on the right, so it's right up here, and so it's sometimes painful there, but it's often painful right where you get heartburn and ulcers, right in the center of the belly. And the classic symptom is that you get the pain here and here. It radiates between the shoulder blades because it irritates the diaphragm, and you get a lot of nausea, and some people get a lot of vomiting with it.
So what about heartburn? That's another thing that...
heartburn, and it's sometimes very difficult to tell the two apart.
Right.
But heartburn tends to be irritation of the stomach lining or the esophagus, the tube that drains into the stomach. But you can get pain in the same place.
What is the difference between heartburn and acid reflux, or are they the same?
Yeah, well, heartburn is a symptom of having that. And acid reflux is what often causes heartburn, where you're getting acid. That normally there's a valve at the end of the esophagus.
Yeah. Thank goodness for that.
But normally, because we have really very acidic contents in our stomach, and our stomachs are designed to cope with acid, our esophagus not so much. So it's supposed to keep the acid out. But often that valve leaks and you get acid going back up in the esophagus.
And obviously there's antacids, there's prescription medication for this kind of thing, but people can eliminate bad things from their diet and their habits. What are the kind of things that cause heartburn?
Well, smoking's a big factor, so that's one thing. Alcohol.
I did not know smoking was.
There goes the weekend.
Yeah.
Well, what am I going to do now, Dan?
No, so those are two easily eliminated factors. A lot of it also, spicy foods definitely do contribute to heartburn. Like people talk about certain ethnic foods, and that does make it worse. A lot of it's the timing of when you eat too, because when you're lying flat, it's much easier to reflux the acid back up in the esophagus. So it's better not to eat and then go to bed. So eat right before you go to bed. Sometimes the old cure was to elevate the head of the bed, right? Like to put stones under the bed. So
and you would actually get a little, like a 45-degree angle.
They still do that for certain people. We now have pretty good medications for taking care of it.
Is it called heartburn because people think it has something to do with...
And that, from an emergency point of view, is one of our biggest problems, because a lot of times older people will think, oh, I'm just having heartburn. In fact, they're having a heart attack.
Well, heartburn can be very, very painful. I mean, people have it, simple heartburn, I guess, where it's not that painful, but it can be.
It can be intense. People can come in doubled over. And it's also a lot of reason that people come in afraid they're having a heart attack, and it turns out just heartburn. But the thing is, your stomach, your heart, your brain's not used to sensing pain in those organs.
Yeah.
And we don't have very good innervation of those organs, and they share the same nerves. So it can feel the exact same way. Your brain can't necessarily
Is there
tell
any
them
way
apart.
to distinguish, or if you have it and you suspect and you don't know?
Well, if you wake up in the morning, it's a good chance it wasn't. No, I'm kidding.
If you're smoking and drinking in bed.
If you're alive 24 hours later, your heart's fine.
You know, with heart attacks, for instance, you can get that same burning discomfort, but it's often the pressure discomfort. But still, there's usually sweating. There's often a feeling of shortness of breath.
So go to the second, third, fourth symptoms.
But can you tell 100% of the time on your own? No, not necessarily. But you can tell by the type of person. If it's 35-year-old who's just had a big Indian meal and drank 6 beers, it's more likely to be
just
Mr. Eckford?
Exactly.
That's typical.
So but you know, it is difficult to tell.
Does heartburn get worse as you age?
It can, for sure. Not in everybody, but it can. But we get worried when people complain of heartburn for the first time at 65, or say, because it's more. It could be the heart, it could be cancer, it could be other things. Whereas younger people, it's almost never anything malicious.
I just ate too much, drank too much, and
exactly.
didn't smoke too much.
Anything else you want to clear up with Dan?
Whenever we have these segments, it always ends up me being the confessional moment. It's like,
guilty.
I gotta stop drinking and eating so much.
You're like our how not to model in the medical segment.
But if you have severe heartburn, obviously, if it's really bad, you're not sure, should you go to the ER?
Absolutely, if you have any doubt. And sometimes just for symptom relief, right? You need to come to the emergency room.
Right.
So.
Get something prescription a little stronger than Tums or something.
But they do work. The antacids are worth trying.
Yeah.
Well, Dan, thank you so much. And I'll go get my sliver looked at.
Yeah. Oh, see, now you'll talk about it. You didn't want to talk about it this morning, but Fiona,
I'll talk about it with Dan because he is a professional.
Fiona,
you said that do spiders really lay eggs in people's fingers? Because that's what he said. Does that really happen? Come on, Dan.
We have to explain the context. Fiona asked because she's got a sliver, but she got it while she was peeling an orange. So I said maybe a spider laid its eggs in your finger.
Is that true?
I can't believe you keep getting medical advice from Mike. We have this conversation every month.
My advice always starts with a physical examination.
Oh my God. Oh my God. Okay, a Flesh and Blood. You can pick it up.